Brain cancer is caused by the abnormal growth of brain cells. Cancer happens when one of the brain cells loses its characteristics, which is the cause of this change. Brain cancer starts within the substance of the brain, the nerves, or the spinal cord. It affects mostly adults. It can affect children also, but there's a 1 in 20,000 chance to get this. And if you're a person who has a family history of brain tumors, then you'll be twice as likely to get this disease. It affects all healthy tissues, and the causes of this cancer is not known for sure, but there are some reasons stated, although it's not for sure known if it increases the risk of getting this. Radiation to the head was one thing suggested, because there was a small study of whether the cell phone's radiation to the head actually increases the chance of getting cancer, but later there was no correlation found. And maybe it can be an inherited genetic risk, an HIV infection, cigarette smoking, or environmental toxins like chemical used in oil refines, embalming chemicals, and rubber industry chemicals. Although many growths in the brain are called tumors, not all are cancerous. They can be either classified as benign or malignant. Malignant tumors grow and spread aggressively, overpowering healthy cells by taking their space, their nutrients, and blood. Like all cells of the body, tumors need blood and nutrients to thrive. Benign tumors are not cancerous, and they do not grow aggressively. The rapid growth in the limited space of the skull can cause damage to nearby brain tissue. And the severity of a brain tumor is classified into 4 grades. Grade 1, the tumor is benign. The cells look normal. The cells look nearly normal, and cell growth is slow. Grade 2, tumor is very malignant. The cells look less normal than the ones in grade 1. Grade 3, the malignant tissue has cells that look very different than the normal cells. The progression of the cell growth is actively progressing. Grade 4, the malignant tissues have cells that look abnormal and grow very rapidly. There's also 2 cancers that a person can get. One is more common than the other. If you get a primary brain tumor, it originated in the brain. If you get a metastatic tumor, then these are tumors made of cancer cells that spread through the bloodstream from other tumors located elsewhere in the body. This type of cancer is more common than the primary brain tumor. The most common places that spread to the brain are those coming from the lung, the kidney, breast, and skin cancer. This process happens when cancer cells from the primary cancer tissue enter the lymphatic system and into the blood flow directly. These cancer cells reach the brain and then develop into tumors. The symptoms in a brain tumor are not necessarily specific to the brain tumor itself, meaning they can be caused by other illnesses. To know for certain what is causing the symptoms, one needs to have a diagnostic testing done. Early symptoms are uncommon, but they can happen for certain reasons, like the tumor pressing on other parts, which could keep them from functioning, and swelling in the brain, which can be caused by tumors or infections around it. The more common symptoms, which are in the late stage now, could be headaches, weaknesses, clumsiness, difficulty walking, seizures, changing concentration, memory, attention, abnormalities in the vision, such as peripheral vision loss or double vision, and difficulty of speech. These symptoms that you get are very gradual, and often overlooked by the patient with the tumor and the family members, even for long periods of time. In some patients, the symptoms can be declared if the cancer is located in a certain brain lobe that is important for brain bodily functions, for carrying out bodily functions. Changes in behavior may be due to frontal lobe cancers, while patients with difficulty of speech may be due to parietal lobe cancers. Treatment options for brain cancer are based on the patient's age, the overall health status of the patient, the location, the size, and the type of brain tumor, or the grade. Treatment options include surgery. Surgeons will remove as much of the tumor as possible with minimal loss of brain function, and a portion of the tumor may be given to a pathologist so he or she can analyze it to see what type of cancer you may have. And a person can take anticonvulsants, which are used to prevent or control seizures, or radiation would be used to destroy tumor tissue that cannot be removed with surgery, or kill cancer cells that are remaining after combined treatments. Chemotherapy kills cancer cells as well, but they would inject chemicals such as fluorouracil that stop cells from dividing. Cancer involves rapid division of cells, so that's why cancer is susceptible to that treatment. Hair cells also divide rapidly, and that's why when this chemical is applied, the hair would start falling out. You can also get brachytherapy, which destroys tumor cells from the inside, or bevacizumab, which is a biologic drug that blocks the growth of blood vessels that would feed the tumor. The survival rate of brain cancer really depends on the type again, and whether it can be removed by surgery or shrunken, your age, and the overall health status of the patient. The amount of survival rate after vigorous treatments is usually 10 to 32%, and treatments could lengthen the survival over a short term and may improve quality of life, but not for very long. Radiation and chemotherapy can also increase life expectancy reasonably, and people who have seizures may not do well for the first 6 months, and treatment of brain cancer will rarely result in long-term survival, but it is better to get it than staying with an untreated brain cancer.